So you can see with this patient a couple different things. So he does have a pincer nail, so it's really curved up and around, and he does have a lot of fungus in here. He's been dealing with this a while. You can see he's real swollen. So there's two routes we can take. One is we just take the sides of the nail, so from roughly here over and here over. The downside of that is from a cosmetic standpoint, he basically will have like a little runway left, so it'll look like a strip of nail. So for him, what we decided to do when we talked about it is we're just going to take the whole nail off. It'll get rid of the fungus, it'll get rid of the pincer nail, and he should never have to deal with this again. All right, so he's nice and numb, right? No pain? Mm-hmm. Excellent. All right, so freeing it up. All right. And I have a feeling it's going to be pretty big once it comes out. All right, underneath the nail here. Doing okay? Mm-hmm. Excellent. So this is just a freer, and all that's meant to do is exactly what it sounds like, is free up the skin around the nail. Next up is a hemostat. Slide it under there, clamp down. Doing all right?
Yeah.
Okay, so you can see all of this and that
babe.
was all underneath there.
No more nail.
You feeling okay, sir?
Yeah.
Good. All right, so we'll just clean up a little bit of this excessive tissue down here. And a little bit of this over here. Some of this is just excessive hypertrophic flesh that just grew because of the nail growing into the skin. All right. So now the sodium hydroxide, which is a base, not an acid. We get a lot of questions again about that. So a little bit of blood shouldn't bother this at all. One, two. You can thank the great camera work for Paulina. One more. So what'll happen is once this heals, the skin will actually look either just like the skin on top of his foot, or it'll form a little fine callus over top of it, but overall he won't have any pain with it, which is most important. Overall, for the purpose of the nails, there's really no inherent need for a nail, believe it or not. It's kind of like your appendix. If you drop something on the toe, it's going to hurt. It's going to bother the toe whether there's a nail there or not. So that's it. All right, so what we'll do is we'll put a little bit of Adaptic with betadine on it. This just prevents the gauze from actually sticking on the toe. All right, so he won't curse me out when he gets home to change it. All right, and then we'll have him change this either tonight or tomorrow morning whenever he showers next. And then basically just have him put some Neosporin and a Band-Aid. Within a couple weeks, if not sooner, it'll be completely healed up. Usually ibuprofen takes the edge off for the pain. Really with a nail like this, typically the discomfort of having the nail removed is not even bad compared to what the pain of the nail was. So that's it. Another ingrown fixed. He should feel 10 times better come tonight or tomorrow morning. Anesthetic usually lasts about 4 to 6 hours. So as always, thanks everybody for watching. Like, leave comments below, tell your friends, family, enemies about us so they can watch us too. And follow us on Instagram at Healthy Podiatry. And we'll see you for the next video. Take care.